Hello, and thank you for joining us today on Supporting Private Practices, presented by the American Medical Association and Medline University. Before we get started with the content, a quick disclaimer. Please note that this presentation has been recorded and is for informational purposes only. You should consult a professional advisor for specific medical, legal, financial, or other advice. Please take a moment to carefully review this notice. I'd like to now introduce our speakers for this session: Taylor Johnson, Manager of Physician Practice Development at the AMA, Jeff Cass, Director at Medline University, Tom Balaban, Director, National Accounts, Medline, Brenda Kozak, Senior Clinical Education Specialist at Medline, and Katie Jones, Director of the Affinity Program at the AMA. A quick agenda for what we'll go over today in the presentation. There's an overview of staff training requirements, an overview of Medline University, some learner experience on the Medline University platform, a highlight of the AMA and Medline benefits, and ways that the AMA can support private practices. Now I'll turn it over to Taylor Johnson.
So I'm going to cover a little bit about the trainings that private or independent practices need to consider for their care teams. So physicians in independent practice have several things to attend to outside of caring for their patients. And one of those things is human resource management and training for their staff. Depending on the practice, staff at independent physician offices may need initial training when they are hired, as well as yearly or more frequent training. Some of the required training examples are HIPAA, OSHA, and patient care. Depending on your state and specialty, there may be additional. So once the practice has identified the training and frequency required for their staff, the next step is identifying the right training program to use. So some considerations when looking at all of your options would include looking at that course list to ensure the desired topics are included in the product you purchase, the cost of the training package, and completion tracking to monitor staff progress on all of the assigned courses. So with all of that information in mind, I want to turn it over to the Medline University team for some additional information.
My name is Jeff Cass. I'm with Medline University. Happy to talk to you today a little bit about Medline University's value and offers. As Taylor mentioned, some of the most important considerations when considering training and education for staff is certainly going to be the cost and the available content that's available to your staff. Medline University is a great tool for consideration. Can you go to the next slide, please? So what are the great benefits of Medline University? Certainly that opportunity for your staff to get access to the clinical education that they need, particularly for your clinicians that are required to track CEs, continuing education credits. Medline University has over 250 courses available in their library. About 160 of those qualify for continuing education credit. It's an opportunity for you to have a standardization of care practice in your facility or organization. Everybody's looking at things through the same lens because they're all viewing the same training and education courses. It's also a great opportunity for your new staff to onboard new staff and get everybody on the same playing field. Everybody is viewing things through that same lens. They're all seeing the same bloodborne pathogen course, for example, or the same preventing needle stick injury. Depending on your practice needs, we've got the content for them to be able to start off on a level playing field. And we can help contribute to your staff's needs on an annual training requirement. With the functionality that we have available to your admins, you can set recurring assignments to occur based on an employee's anniversary date, on an annual basis, on a calendar year, or whatever other needs you have for your staff training objectives. Next slide, please. Overall, what we hope to do is help you address your most pressing staff education challenges. If you're facing challenges with driving standardization, managing through change, or even hiring and retaining staff, we know the last couple of years in particular have been a real challenge in that area. Medline University is here to help. Obviously, education is a key component for driving that best practice and standardization. It's an opportunity for you to provide some consistency as you've been experiencing any disruptions due to change. And certainly we're a great tool, we're a great value to you as you're bringing on new staff, or perhaps even a great tool and opportunity to help retain staff because we have that opportunity to get everybody their CE credits. So we've partnered with a number of trusted education partners. In particular, Medline Industries has providerships with the California and Florida State Board of Nursing. It's because of those providerships that we're able to offer the CEs again on 160, 170 of our courses. We also have quite a few courses reviewed and approved by ISHM and CBSPD for central sterile techs, PACE for some lab techs. What's missing on this slide, though I hope to get it added sometime in the future, is we recently secured AARC approval on about a half dozen courses for respiratory therapy. And AMCA is an organization for certified nursing assistants. AMCA has reviewed about 40 of our courses as qualifying for AMCA certification. So if you've got nursing assistants that are AMCA members, they can take several of our courses and provide that information back to AMCA for AMCA certification. And now what I think I'm going to do is I'm going to turn over to Brenda for a couple of minutes, who can talk a little bit more specifically about some of the content packages that we have available.
Okay, thank you, Jeff, so much. So as Jeff said, I'm the clinical education specialist at Medline, Brenda Kozak. And I'd like to get into a little bit more detail about some specially curated content packages to help with your onboarding, communication, and health equity needs. Many of these courses have contact hours, which can be used for earning CE. Some typical onboarding courses you might need would be HIPAA, bloodborne pathogens, maybe infection control courses. We also meet your communication needs with leadership, patient-centered care, and some effective communication courses. For health equity, we do have some courses that talk about culturally competent care, which is needed by all staff, health literacy to help everyone understand a common language in healthcare, and then some communication and culture and family end-of-life care are some examples of courses we have. Next slide, please. We value your feedback, and in response to some current trends in healthcare today, we have some new topics that have been implemented this year. For example, to address the opioid epidemic, we have our Battling the Opioid Epidemic course. To address nursing burnout, we have Self-Care for Nurses. And to address the increase being seen in workplace, we have a couple of workplace violence courses. Also new is the micro-learning courses. Micro-learning courses format are very valuable because we know time is valuable, especially with staffing shortages and with staff time being so valuable. We offer these courses that are 8 to 14 minutes in length, yet they provide a comprehensive learning opportunity. Some of the topics we cover are infection control, such as the CAUTI prevention and indwelling urinary catheters for healthcare assistants. We have some safety courses, the workplace violence and safety culture, communication lessons, and then also patient-centered care for LGBTQ patients. Next slide. I'd like to share a little bit more in depth about what the learner experiences when they take a course. These are some examples of the interactivity we use for our courses. We've optimized the learner experiencing by providing clear and concise interactive content. This type of e-learning lends itself to a higher learner engagement and also may help achieve a higher level of staff retention. To follow up on what Jeff had said, our content is mobile optimized, and anyone just needs an internet connection to be able to take these courses on whether it's a tablet or a mobile phone. Let's add an example in the middle here with external factors. This is our workplace violence course, and it just has a functionality where you hover over the plus sign icons and it reveals more information regarding risk factors. So it's very interactive, and the learner feedback has been wonderful on these courses. The last course on to the right side of the slide is Barriers to Culturally Competent Care. And in this slide, we see the learner will go up the stairs, and as they go up the stairs, they're learning more content and achieving more competency in the learning, which is again titled Culturally Competent Care. The micro learning courses are tailored to learn the content when CE is not necessary. So we have courses to fulfill both needs for CE and for non-CE staff.
Thank you very much, Brenda and Jeff, for diving into the Medline University portion. Very happy to be here. I'm Tom Balaban. I'm the National Accounts Director for Medline, very much focusing strategically on our partnership with the American Medical Association and how we can deliver additional value to all of its members. Medline, we are the preferred provider for med-surg distribution for all of the AMA members. And before I dive into a little bit of this, I do encourage all of you to take out your smartphones and scan with the camera the QR code in the lower right-hand corner. This will immediately link you to the American Medical Association's website, and more importantly, the landing portion of that page for the buying program. So if anybody needs to reference that, a lot of this information will be found there again. For those who are not familiar, being the preferred provider for the MedSurg program and buying program for the American Medical Association, Medline, we are a manufacturer and distributor in the MedSurg space. We have over 300,000 different SKUs covering both medical, surgical, as well as pharma products. We cover a full line of capital and can essentially cover every nuance when it comes to the medical supplies needed in your offices. Some of the benefits that you'll get from partnering with Medline through the AMA's buying program is up to a 20% savings. We've had a few instances and some nice success stories where we've actually shown north of that 20% savings. But we want to be able to live up to the expectations that we set. Big believer in under promising and over delivering. We have next day delivery turnaround and very low order minimums so that you don't have to be worried about paying freight or incurring that on your side. Medline ends up covering that on our side as long as you do meet those minimums. These can vary, depending on the type of practice, but typically $150, and you're not paying any sort of shipping charges. Also, we have about 50 different distribution centers located throughout the country. So there's really no corner of the United States where we would not be able to live up to the expectation of getting you next day delivery. We also are a full extensive manufacturer of apparel. That's lab coats, scrubs, and other textiles. Honestly, how Medline even got its start in the game. So a big portion of our business there. We do embroidery, we can add logos. So there's a lot there that we'd always be happy to dive into with you. I think one of the biggest things is if you do scan that code, QR code, and you get to our landing page, all of those leads, if you will, come to me, where I then get them to the local divisional manager and get a local rep to reach out to you to really dive into the specifics of the program. We do a no obligation cost analysis where we identify the savings that we can show with you, and we partner with every variety of GPO out there, the group purchasing organizations, to make sure that we're delivering the lowest cost possible for you and your practice. Again, as Jeff and Brenda had highlighted, we have the Medline University program that you will be able to take part in and reap the benefits of that. And there is zero cost to become a member of this program for all American Medical Association members. I encourage you all to reach out. Again, it doesn't hurt to find out what kind of savings we can show you, and look forward to working with you all in the future. With that, I'll hand it over to Katie.
Hi, Tom. Thanks so much. And as he mentioned, the Medline University component is part of the AMA Medline buying program. And to better help you efficiently meet your regulatory and compliance requirements, we have worked with Medline to come up with this tailored course curriculum. It's really easy for you to go in and assign this out to your staff. If you're interested in taking part in this, as a follow-up to this webinar, you will be receiving a communication on how to get started and get enrolled and begin assigning those courses. Or if you need help doing so, there'll be contact information on the following slides. Just reach out and either AMA or the Medline folks will help you get registered.
Thank you to our speakers for sharing their time with us today. As Katie mentioned, here's some contact information. If you have any questions, to reach out to the AMA here. This is the Practice Sustainability inbox. And on the next slide here, we have contact information for Medline University if you have any questions or would like to figure out what you can use. Thanks and have a great day.